Good day, everyone. I am Ronald, the moderator for this webinar. I welcome everyone to today's webinar that will be on chronic care management. What do you need to know to design and implement a successful program? I want to introduce our presenter for today. That will be Dr. Irina Kaufman. Dr. Kaufman is a nurse practitioner and a doctor of nursing practice with 25 years of nursing and 15 years of executive experience. I would now like to hand over the floor to the speaker. Over to you, Dr. Kaufman.
Thank you very much. Hi, everybody. Thanks for coming. CCM has been a hot topic for a while, so let's dive right in. And today we will discuss chronic care management. I will be calling it CCM going forward. I will also discuss principal care management, which is a PCM. We'll go over all of the scopes of services and we'll talk about the successful implementation plan and evaluation plan. I always like to start with a little bit of history to understand why certain things were designed and implemented. And in 2015, Medicare heard from providers loud and clear that they were tired of doing all the work in between office visits and they were not able to get paid for it. And in 2022, this is really where CCM became super, interesting for people because Medicare actually increased the fee schedule. So let's talk about what is chronic care management. What is CCM? Medicare said CCM is the care coordination or care management that is happening outside of regular office visits for patients with 2 or more chronic conditions. Who are the patients that qualify to be enrolled in CCM? Medicare provides you example of what chronic conditions could be. Keep in mind, what does a provider needs to do in order to be able to bill for CCM? So before CCM starts, as I said, patient needs to be seen by the provider who's billing for it within 1 year or consent. Consent is very, very important. It used to be written. So after the consent, you have to start writing a care plan. What is care plan? What can you bill for? Like what are the CCM activities? And as you can see, comprehensive care plan is, number one, you have to have it and design it. Anything you do for or on behalf of the patient in between the visits should be counted as CCM. So let's talk a little bit about billing. Who can bill for CCM? Billing providers are considered physicians and the following non-physician practitioners or NPP. Who cannot bill for CCM? Clinical psychologist, podiatrist, dentist, and remember only one provider can bill for CCM per month. That's very important. We know who can bill for it, but who can provide the services? What's important is it can be done under general supervision. This is a little hard to read. I apologize, but I want to show you that clinical staff, it's not just whoever you think you call clinical staff. There are two definitions, one by the CPT that owns by American Medical Association and one by the CMS or Medicare Medicaid Services. I just want to show you here an example. After 22 payment increase, nothing really changed. Therefore, it kind of stops here at 2022 payment. As I said before, as of 2022, we can bill CCM together with transitional care management. What you cannot bill CCM with is if you're billing for home health supervision, G0181, or if you're billing for hospice care supervision, G0182, or if you're billing for certain end-stage renal diseases, codes are 90951 to 90970. If you're billing for any of those codes, then CCM is going to be rejected. A little bonus code, principal care management, stays the same, except it's really for patients that you're taking care of one chronic condition. So reimbursement opportunities is that financial benefits. So then the question is, do we outsource the CCM or should we do it in-house? There's pros and cons in everything. How do you think about when you're evaluating outsourcing the team? When you are evaluating clinical team, you want to make sure, as I keep saying again and again, their licenses. So you wanted to really look for in the software, like, is it one trick pony? Are they only doing CCM? Do they also have a PCM? So pros and cons to using EMR versus using CCM platform. There's a lot of challenges in this space and best practices. I can say I have not seen a successful CCM program if they don't have team meetings Like everybody needs to get together at least once a month, hopefully a lot more often, to understand, do root cause analysis of, who are the patients that got admitted or readmitted. You should have clinical conferences, understand, what patients are going through, what they can help with. And definitely you have to have a designated person on your team if you're a provider and you're outsourcing it. And with that, I want to thank you so much for coming and for sharing your time with me. And good luck to you implementing or maybe making your program better.
Thank you so much.
Thank you, Irina. Thank you, everyone, for your time. Have a wonderful day.
Bye-bye.
Bye-bye.